Medical Dilemma.
Welcome back to Medical Dilemma. We'd like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment of our discussion are my co-host, Attorney Sara Jane Suguitan, and Father Jerry Manlangit, and of course, Dr. Attorney Teresita Sanchez. Okay, welcome back to the show. Now, earlier we were talking about the symptoms of depression. And I used to be a school administrator, Dr. Gochu. But, you know, I'm really not really aware of, the symptoms of anybody suffering from depression. Now, I get students who say that they are depressive, but I'm really not sure how to tell. So could you give us an idea of how people like me can determine if a person is really suffering from depression?
The symptoms of signs and symptoms of clinical depression would include depressed mood, feeling sad most of the time, loss of interest, things that they like to do before, like for example, they like to, let's say, draw, or they like to go out with friends, those things they're not able to do anymore. There could be changes in appetite, either kumakain ng sobrang dami or they don't eat as much. Okay. There could be changes in sleep, sleeping too much or not sleeping enough. Sometimes they have like very poor concentration. Sometimes there's just like so many thoughts in their head, a lot of guilt, I'm so sorry, asking for forgiveness for things naman that they didn't do, a lot of inappropriate guilt. Sometimes it would, and of course, what was scary is like if they reach the point that they have like suicidal thoughts already. Those are the signs and symptoms of clinical depression.
I see. Now, as a former school administrator, I had so many experiences with students who have admitted to me that they are suffering from depression. And these are...
So they self-diagnosed?
Well, I don't know if they self-diagnosed, but probably they came from a psychiatrist also. But these are students that are 18 years old and above.
This is abroad, right? I
Most
know
of the
you
cases
taught
were
abroad.
A couple were here locally. And this is my problem. So when I am told by somebody, a student, that he or she suffers from depression, my first reaction is to tell the school's guidance counselor and the affiliated psychiatrist that this is a student that we have to watch. Okay? My worry now is, am I breaking the confidentiality right of a patient suffering from depression?
Yeah, that can easily leak out, no? Sarah, what's that? Huh?
Yeah, so as a general rule, the doctor-patient confidentiality has to be observed. But of course, there are exceptions to the rule. And these are, for example, when the diagnosed patient is a minor and he or she can be harmful to himself or herself or to others around him. And also when the patient or the person suffering from the said depression is not capable of making say an informed decision in the sense that for example, there are abroad those who are incarcerated who are put under suicide watch. Ganon. So yes, tapos you have to observe also in our legal system there's a plea of insanity and depression. There have been cases now wherein the accused has been diagnosed with depression and that he or she was not acting as himself or herself, so not of the right mind. So there is a slew of yes, doctor. There's a slew of exceptions to the general rule with regard to doctor-patient confidentiality.
This is my difficulty.
But how about in school? Yeah.
Yes. So how do I know if a student suffering from depression will have suicidal tendencies or the capability to harm others? So my reaction always is to better tell na habang maaga just in case something happens.
But siguro at first consultation with you, probably do not panic and tell everybody already, because it might discourage the child from consulting further.
That's right.
And it might break everything.
But as a school administrator, I have hundreds of students under my care. So I'm really torn between one person's confidentiality and the safety of the other students.
Maybe just to be, at the onset, you can ask the patient already, the student, can I tell this to the guidance counselor? Maybe you can teach or advise us, ganon. Can I tell to your parents?
Well, we
Yes.
can take the example of patients in the hospital, for example. The principle of confidentiality and privacy must always be upheld in the hospital, although these are not always absolute. In case, for example, in which, well, in your case, a school, I don't see any problem about telling the counselor, for that matter, or the parents, for that matter, for as long as you tell it to people whom you know have a task of caring for these people.
Okay,
But
so
if you keep telling on other people who do not have anything to do with the student
with that student,
or with the patients, for that matter, and that is where you're going to break confidentiality or privacy.
I see.
For example, even for example in patient care, no, we know for a fact that there are patients, especially in training hospital, no, well, you have all the nurses there, the residents, and even interns, for that matter, or they will know. And I don't think that you break confidentiality and privacy, well, because you are entering into a hospital, which is a training hospital, and many people would know your condition, etc.
Yeah.
I don't see any problem with that.
Anyway, Father, these people are also covered by
By
that confidentiality law. In other
That's right.
words, they cannot also reveal.
And which
even
means
though
that if you extend it
contact.
with the principal or a director or a counselor, for that matter, these are people who must be able to know the conditions of the patient, because what you're doing there is you're trying to be more preventive,
Yes,
because there might be
yes.
some harm that these people might do, especially so that depressed people are sometimes very irritable. I don't know, doctor. They might be
Sensitive,
irritable,
maybe.
sensitive, or probably angry. They might even be assaultive. If they can have suicidal tendencies, they can have also behaviors that can also harm other people. And if you're not going to do this, then probably we are committing omission of our responsibility. I think this is ethically founded.
Okay, so I'm quite relieved with that. So that means I'm doing the right thing
After the fact.
after the fact. Yes.
But Father, what if, for example, word gets around that Sonny, like if you went to Sonny, then, he might tell, the school, the guidance or whatever, and, they don't want to go to Sonny anymore to talk with him.
Nobody's going to do. Nobody's going to know.
Maybe
the only
he'll
one who
ask the
knows,
permission
And
first.
the
One who
only
knows,
one,
and the guidance
and the guidance
counselor,
counselor, as I've
and the
said,
psychiatrist.
he is not supposed to tell anyone who does not have anything to do with the student or anything for that matter, which means that
Besides-
wala kang pakialam. We are the only ones who have this responsibility, the task of making it, making the school safe, making himself also safe, that he is not going to harm himself. That is why we are on the lookout already, that if something happens, we can prevent immediately, and that harm will not be that much, too large and too big for that matter.
But Father, can they already inform the guidance counselor even without the knowledge of that
Yes,
student?
I think so, because you are
because
given
he is not the
task.
expert anyway
Yeah.
in the psychiatric evaluation or psychological evaluation.
I don't think
Right.
there is anything harm here. I feel some behavioral problems with this. He has changed because there are changes already. Where, a depressed person do have sometimes sudden changes in the behavior. He has
Attitudes.
changes in pattern of eating or acting, etc. And the way he, for example,
Interact with the
interact with
classmates.
other people.
Oh, oh.
Why like that? And there must be something.
Although, I
In
just
fact,
want
Father,
to...
in the cases that I have encountered, the students themselves admitted to me that they are suffering from depression, they're taking medication,
Yeah.
but
So-
of course, I really don't know how to tell if a person will be having suicidal tendencies or might be able to harm others. So
Right.
that's why my reaction is make sure nothing happens. So
Right.
even though slight chance na manakit siya or mag-iba yung kanyang behavior, sinasabi ko na kagad sa guidance counselor and the psychiatrist. My thinking is, what if I'm not in the school when something happens? So who's going to handle the case?
Oh, don't be
And that's
too,
precisely,
sensitive
the
about it.
problem. If you have not told the guidance counselor
Yes,
for that
oo,
matter,
right.
knowing that you knew it already,
Baka mas may
you did not
liability
warn
siya, no?
the counselor, and there is more problem there.
Okay.
There is more problem. You knew it already, and probably, why did you not tell the very people who are supposed to take care of these people? And that's more problematic.
Yeah.
I see.
In passing, can I just mention that the signs and symptoms are similar to also one who is a victim of child abuse, no? I
Child
just want
abuse.
to be aware that our audience should know that too.
I see. Now, if we project the same situation in the workplace naman, okay, are our bosses required to do the same that I did for a school?
Well,
Okay, yeah, the law is not clear on that, no. Although I think what the patient can invoke is his or her right to privacy. So this is a private matter. An employee who is suffering from clinical depression has the right to keep it to himself or herself.
Okay.
Now, yun nga, unless you know that there's a danger that he or she will harm others, then that's the time that the confidentiality rule admits of exception. So, when it comes to, yun nga kasi iba yung analogy nga ni Father. Sa school, when a student, even if he or she is already above 18, college students, for example,
Yes.
who are in school, are under the supervision and control of the school. So that's why we had cases now during field trips, the school is liable if something happens to the child. So you're doing the prudent thing by advising the guidance counselor, no? Kasi in case that something happens to the student in your absence and you knew that that the student was suffering from clinical depression, then you might put the school at risk as well in terms of being liable for if something happens. So in the workplace, same with the hospital setting, kasi all of them are bound by the confidentiality rule, no? But however, if they incidentally knew about it in the course of doing their business or their profession, then that's also covered by confidentiality, no? But at work, it's a matter of privacy of the employee.
So an employee who, let's say, suffers from depression and goes back to work, this employee is not obliged to inform the workplace, his superiors or her superiors, that she or he is suffering from that condition?
Okay, I wouldn't think so, no? Halimbawa, in court, if you are absent, if a lawyer is absent during a hearing, you have to present a medical certificate. And all that medical certificate has to say is the symptom, like if you have a fever or you're not feeling well, that's yun lang ang nakastate sa medical certificate. It doesn't say what is going through your mind or your emotions, no? So, if the clinically depressed employee goes back to work, and well, if he or she has to justify the absence, if it's not covered among his or her leaves, then well, kailangan ng medical certificate. Then it depends siguro, Doktora, what the medical certificate will say to justify the absence.
Of course, they're not obliged to divulge their character, really.
They are not obliged to divulge.
really.
Okay.
Very clear, yeah.
Unless, of course, you will be able to know, because his behaviors are becoming
Erratic already.
and
Yeah.
then he becomes irritant, and he quarrels with just about
Yes,
everybody.
And the next question is, so maapektuhan yung performance niya. Now, come performance evaluation time in
Oo,
the
mabibisto.
workplace, paano yun? How do we handle that?
Well,
Yeah.
I
Can
would
I fire or terminate somebody because of such behavior?
For example, chronic absenteeism, lagi nang absent, no? Then the reason for discharging the employee will be the absenteeism, but not the depression. And even though he or she doesn't tell na,
Yes.
depressed ako kaya ako lagi absent, it does not justify the failure of the employee to show up on working hours. Absent na beyond his sick leaves, no? So
Okay.
kapag lumagpas ka na doon and lagi ka na absent, then that's a cause for a valid discharge of the employee or valid dismissal.
Of
Okay,
course, hindi to
yes.
bigla-bigla. Of course, di ba? It takes
Due
time.
process.
You know, you have to follow due process and analyze very well. Kawawa naman yung patient. Sorry.
All right, so we'll have to take another break at this point. Don't leave this channel. We'll be right back after a few words from our sponsors.